Okay, good morning. I'm calling the Board of Health meeting to order at 7:04 a.m. on October 12th of 2021. And we have all members present. So good morning, everyone.
Good morning.
And we are here to discuss the draft presentation for Fall Town Meeting for the budget increase for Board of Health. And I think when we decided to do a PowerPoint presentation last week, or at least that's where I think we were headed, or a few weeks ago, I didn't realize we weren't gonna have a screen at town meeting to display. So I started a draft presentation for us to review this morning, but I think it's probably better for us to do a report, like a one-page thing that we can hand out at town meeting. And then we can present as if we're doing a PowerPoint. But I think printing slides, you lose it if you can't like see it on the screen. So What are your thoughts about kind of doing a one pager?
Yeah, I think people respond well to bullet points, very like laid out nice bullet points versus flipping through, a slide set. I agree 100%.
Yeah, I agree as well.
Okay, so I think this morning, if we can get on paper kind of the ideas that we want to put, and then one of us kind of write the report, go to Dr. Fazen's forum, and then do any revisions, final tweaks after that. Good?
Okay.
So what I'm going to do is I'm just going to pull up a Word doc, and we can just kind of brainstorm on ideas of topics that we have for that. Let me just share my screen. Can you just see that blank Word doc?
The blank, yeah.
Yeah, okay. Okay. So I know we talked last meeting about some of the initiatives that we're working on. So I think we should probably kind of list those out, even if it's at a high level on things that are coming up. So some of the grant opportunities that we're applying for.
Yeah.
What else?
This is one of just how many, so if we talk about, grant initiatives, do we want to look at each of those as with a long-term goal then that's there? Because it looks like the advisory committee is really looking towards long-term.
Yeah,
long-term sustainability.
I agree with you. And I think that we probably as a board need to communicate to advisory what direction we're going in, right? Like long-term, like they want to know if these positions are permanent, right? Are they going to be on the health department's payroll for the long term? And I think after reading through Dr. Fazen's report and some of the appendices that he attached,
right?
I think we should be open to, or this is my opinion, I would be open to having everything on the table and figuring out what is the most sustainable model for Southborough, and where are we going to, directionally long term, does it make sense for us to share resources amongst other towns, kind of like what we're doing with the shared service grant.
Right.
That's kind of that's my feeling. And I think with having the public forum coming up, we'll get public input hopefully on what people's reaction are to the report. But I don't know what you two think about, after reading that, what your thoughts are.
To me, I think shared resources is the way to go, and I think we can use some evidence that we've done so far through the pandemic that shared resources work. So I do think that part of our long-term goal will be, some kind of shared plan, vision, resources with Westboro, Northborough, whomever we decide to share with.
Mhm.
Yeah, I would agree.
Okay. And
But
I
I
think
do
that-
feel like even with this share, the grants we have now, I still feel like we need our staff even to implement, regionally kind of right now.
yeah, and
I mean,
I agree. And I also think, Nancy, that in May, I didn't think we'd be sitting here in the situation that we're in still.
I know.
I mean, I understand,
I
Right.
know.
right? So I think that, with the contact tracing that's still going on and the support that our staff are giving to the schools right now,
Yeah,
I thought we would be in a different position and we would be explaining what else they're working on
Mhm.
I know.
more. I mean, I do think that they've been able to get, some initiatives off the ground, which has been great. And then they're getting pulled
Right.
back into doing mostly COVID. So,
I know.
I think we almost need to figure out what model works and how to best use
Right.
staffing. There was an interesting, I don't know if you saw it at the bottom of the blueprint. I think it was page 93 or something. It referenced kind of the different phases that you could take an approach on for sharing services and different levels of that. And I think that might be what we should talk about in our meeting in October,
Mhm.
is what kind of phasing do we want to do, and what kind of services do we want to share for
Right.
before, and that could be a short term thing and then looking longer term. So hopefully that answered your question, Safdar.
Yeah. And I think,
Okay.
so to your point is, this pandemic and how do we look beyond it? Like there is an immediate need that we probably should address, I think, in terms of the degree, in terms of dealing with the pandemic. And I think there are success stories, and that's where we can use the fact that, we've done, whether we use our vaccine or the collaboration with the schools or what we've done since the spring. I think that is a good model, is that, we needed our staff to do this, and this is what we want moving forward for, whatever lies ahead, and I think that whatever lies ahead, we can now start to quantify. I don't know if that makes sense. Let's talk about the other, quote unquote threats to public health that we need to look at, because they're still there. There are other threats that are there, and we need to look at those.
I feel like the shared services is going to help, it'll help us do tobacco and restaurant inspections and those kind of things that can kind of, you don't want to get behind on those just because there's a pandemic.
Right.
But I do think for the foreseeable future, we still are going to need our staff for a few years at the, capacity we have them with these different variants and things, I just don't see it going away.
And if say, whatever, we look at case numbers getting less, I mean, we still can do better. Their time can be used with more flu vaccine, or, depending on directions COVID vaccines take, or there's so much more they could do if they had time, even within the construct of infectious disease.
Right.
Yep.
Yeah.
I'm just kind of putting this down, and then we can figure out how we want it
Sure.
to go. Okay. I think the other thing that I'm thinking of is septic, right? Like, we're so heavy in town on septic, and we have, we obviously have Dennis and Safdar, you weren't on the board, but we need to figure out how, with new labor council, that his contract, because there was some discussion with past labor council about, is that the best way to employ this position? And then we have the backup from Sudbury now as well. but is that the best model for a Southborough, right? Where we're so septic heavy. So that's another thing I'd like to look at, is, going forward, how do we best use the resources that we have, right? And
because essentially
making sure
that's our bread and butter too, like the inspections and all
Yeah.
that. So
yeah. So I think we need to put something in there on, exploring inspectional services. I also know that Barbara has been working on the trash hauler
mhm.
piece. So I think we need to add something in there about where we're at with that.
Mhm.
And back to the initiatives. Safdar, you had mentioned something in the last meeting and it's escaping me on, I think a collaborative for substance abuse. Maybe? Was
Yeah,
there
so
something?
there's the Northborough
Yeah.
Southborough Substance Use Prevention Coalition. So, both Heather and Taylor serve on that commission. So, and that's, it also right now it's looking for some direction too. But I think as we move to the future, once that coalition is able to get some more direction and traction, I think 2 years, it's sort of behind because of the pandemic, 18 months behind now because of the pandemic, but, working to assess our substance use problem and to tackle it, our youth substance use that's going on, not just tobacco, but alcohol and marijuana. So I think, and that, and opioids. So we need to really have some sort of, I think, outline about that in here, because that's a resource. That is something that we will have our public health people involved in, I think, as we move forward.
Okay. Okay.
And I think the pandemic has exacerbated a lot of
Yeah.
people's
Yes.
substance abuse. So, I mean, we can't get behind on that.
Okay. And on the grant opportunities here, we can talk about shared service. We can talk about the FDA grant and the air quality.
Mm.
So I think those are the three that we have going on. I also think that with being with the other towns, we've gotten better resources, meaning we've been able to get vaccine. I don't think we would have gotten vaccine on our own. We can apply for regional grants like this FDA grant. So we can get level 1 on our own, but then the regional one wouldn't have been available to us. So I think
Right, yeah.
we're also able to do that. And I also think it's helpful to have the other towns to talk about what options exist for things that we can apply for, right? So it's kind of being able to brainstorm with your peers and
Mhm.
on a separate level than just kind of what you have in the region, right?
Right. Yep.
And I think with the shared service grant in particular, I think we've had a huge win with Diane being able to get the restaurants up to speed.
Yeah,
Absolutely.
And
Yeah.
I mean, that was extremely beneficial to Southborough.
Mhm.
Okay.
now is Diane's position also permanent right now, or how's that? Because that was
So,
for my time. She just
so
part of the grant.
she was 7 hours in Northborough prior
Right.
to the shared service grant.
Mhm.
And then the shared service grants paying up, I think it's 30 or 32 hours a week. And she, we have that grant for 3 years, but I think there's 3 renewal options. So that could be a
good.
12-year grant. So I would say it's permanent in the sense that she'll be here for 3 years, but could be up to 12, depending on if we continue to get this grant.
That's wonderful.
Which I think is, I don't think we're big enough to have a full-time position for that in Southborough. So
Right.
that really
Oh
makes a lot.
God, no.
Okay. was gonna add something else on the short and long term, or maybe I'll just add it to the shared service grant. So we got housing and food and nursing hours. I know that that probably started like a month ago. So I think in our next meeting, we should probably get an update on, what that nurse is working on. And I know that they'll be helping with the flu clinic as well.
Right.
And then software. And maybe we can get an update on how the software is going.
The other thing I might add with substance use then is so one of the things that's come out is I think the mental health. So the town
Yeah.
really, and that's, direct need of the people right now in the town is mental health. And, Dr. Faison, I think, touched on a little bit about how can a board of health help, with the mental health of the town. And it may be, whether it's through educational initiatives, whether it's through connecting people. I mean, Southborough Youth and Family Services does some of that, but I think this is where, again, they can collaborate with other town departments, staff time to collaborate with other town departments to help with something like that, like mental health.
Right. And also collaborating with the senior center, because
Right.
the isolation for some of the elderly has just been so detrimental.
I agree. And I think the senior center nurse helps with some of that, even though she's not
absolutely
directly under, under the Board of Health. I do think that there, at least there's the connection there. And I know she's been running some programs. So maybe I'll just say that we're
collaborating with,
Yeah.
And that's sort of my thing about mental health is, we'll have to use collaborate because we have youth and family services in town.
Correct.
But clearly, we need, I personally think we need public health involved in it as well.
Yeah.
So.
Okay. So I think that's good. And it may be helpful if we have Dr. Alper give an update on kind of the things that she's working on related to this, because I think she probably does have some things in process with youth and family.
Yeah,
I'm sure. Yeah.
Okay. And I think Taylor did a booth, right, on mental health at Heritage.
At least so. I
think I didn't get to make it, but.
Okay, so info. Something else that I think we should add under initiatives is that Taylor did that community survey. So to try to get public input.
Yep.
And the communication intern to help get the channels of communication going between the health department and the public.
And also, I think, Taylor collaborates with the school nurses too.
Right.
So she's actually been helping them with their testing. So
I thought so.
Yeah. I mean, right now with the test and stay program, any child that's been exposed gets tested every morning before they actually enter the school building. And Taylor's actually been helping with that. So I think, Taylor's role in collaboration with the schools is something that will go beyond the pandemic for sure in whatever they need.
Yeah.
So, right.
And it should really,
Okay. What else? I mean, I don't want it to be too long either, because we'll lose people.
Yeah, you will.
But
what about, wasn't there a list on our town meeting, when you do your yearly, oh my God, I've got such brain fog.
Your yearly report?
Yeah, I think that might jog our memory to all the stuff.
Sure.
I know Mary Lou, I think, did a really good job with that.
So let me see.
The annual town report. Yes, thank you.
I don't see this year's town meeting. Why not? Let me see if I can do it from the news flash. Oh, I also think we should talk about boosters and kid vaccines.
Yeah.
Right.
Yeah.
I know Taylor's got a bunch of dates for booster clinics, so.
Yes. Let me know. Can you see the town website or no?
I can't, my computer's.
Maybe it's under town clerk. Hold on a second. Sorry. I should have had this pulled up already.
Oh, no. And I'm not helping very much.
I'm looking, I can't find it, but do you know where?
I don't.
Yeah, I don't know why it's not on the town website. Oh, town meeting information. No, it's 2020. I don't know.
Did they do it in 2020? Did they do another one?
Yeah,
Yeah,
I'm pretty sure they were handing it out at town
Eh,
meeting last summer.
Yeah. I wonder
Or
if it's
May,
on our
whatever
website.
it was. It was May. Yeah.
Yeah.
I can look back through emails from Mary Lou. Let's see. It's gotta be
Actually,
there.
see if I can pull it up. So it would have been sometime in May, probably, right, Nancy?
Yeah, like April, May.
I got it. Okay.
Just grabbing my hand sanitizer. I'll be back.
Okay. Can you see that?
Let's see.
Oh,
Can you see that, Safdar?
All right, I'm back.
Yeah, yeah.
Yes,
Okay.
I can see this now.
I'll stop navigating my side. So, yep, there we go.
Okay.
All right. We might be able to use some of this. Excuse me. Hmm.
So,
Yeah, I thought it would have, I thought it had more.
so I actually think the last bullet here, record digitization to move our paper records to a searchable digital system. This was a lot throughout that blueprint report.
Right.
So I think we should probably include something about making our records digital.
Yeah.
Yeah,
So-
maybe more secure, and we're working on improved privacy, because maybe people are, hesitant to
Mhm,
reach out if they think, it's not as secure as it could be.
mhm.
I don't know. I'm just throwing.
Yeah, no, I think. Oops. Okay, so that's what we handed out at town meeting.
Okay.
And at the top was the amendment to the budget, staff deck.
Yeah.
Okay, so I'm gonna go back to our notes here. So I think we need to somewhere put in here, create sustainable funding and structure. Okay, any other topics that you think we should include in here? We'll have another go at this.
I
in case-
still have Mary Lou's thing up on my,
Oh, you do? Oh, sorry.
Share that? Would you be able to share that, Nancy?
no, the thing that she had up earlier.
Oh, okay.
I don't have what the, you know.
There you go.
There we go. Okay, thank
Okay.
you.
Sorry, I didn't realize that.
That's okay. Um,
All right. So I don't know if the other thing we want to look at, and this may indirectly pertain to this, Chelsea and Nancy, is are the results from youth and family services and their needs assessment. Although it was specific to them, there's a lot of, mental health and substance use data on there that we can pull from, because that's on their website.
Yeah. Yeah.
And I think, it goes again that there is, given the fact that the sheer percentages of people worried about that, both in the focus groups and in individual answers, I can dissect that a little bit
Okay.
later on. And
then
maybe
I'm gonna look
things from there.
and I'm going to look back too, and I can reach out to Mary Lou, because I feel like there was a better list of everything we do, and it may have been something she presented to advisory. So
I think, yeah, let me see if I can find that.
because the annual town report, that's not what I'm thinking of. I know there was
Okay.
something that
Try this, Nancy.
oh yeah, this might be current. Oh yeah, okay. I think this is it.
Okay. Let me know when you want. Next slide.
I'm good.
Yeah.
Okay.
Full funding. Okay.
Yeah.
And those are the numbers.
Yeah, which have changed.
Right. Okay.
We could, our budget does not bring us to the blueprint levels. Okay.
So this is all this. Okay.
But I think it was good how she pointed out, these regional things so far, they're really not replacing, they're just helping us meet
Right.
unmet needs.
Right.
A lot of it. And obviously, they've been helpful with immunizations and vaccines and all that.
Right.
Oh yeah, did we put anything about the tobacco?
Yeah, it's right. Metro West Foundation grant.
Yeah, we got to do that. So, yeah. Okay.
I was Just adding tobacco, okay. Right, so then we scored how well we're doing.
Mhm.
Right, right.
Electronics, okay. Okay,
Yeah.
So this should look better now
right,
than it did at
Right.
that time
I
because
agree.
the shared service grant helped, right?
right.
Absolutely, yeah. Yeah.
So I think on the second and third one here, we probably just need to get an update at our next meeting on if we're improving on this or not.
Okay.
Do we have someone who is responsible for that? Is it Dennis who's responsible for the rules and regs for trash removal too, or is it somebody else?
So Barbara gave us our last update on trash removal. So I would need to find, I'm not exactly sure.
I don't, historically, I don't think that has been Dennis or Paul, but
Okay,
I'm
okay.
not sure.
Because it seems like that itself needs work. A lot of, there's some fair work involved in that, and
Yeah,
Right, and I don't know if DPW, I don't know if they have something in with that too, because they're kind of the transfer station and that
Right.
whole.
so this should also look better.
Oh yeah, we got to add housing code issues, yeah.
Yeah.
Because that
So
rears
I
its
included
head.
that as part of the shared service
Okay,
grant. So maybe
because I
it
mean,
would
that
make-
can get ugly. Sometimes they have to go to court for days on end. And I mean,
right.
I know Dennis has had to go to court numerous times. Paul has.
So maybe we need to go through these slides with the staff and
I
see
think so, yeah.
if
Yeah,
we can
yeah.
update them.
Yeah.
I mean, I don't think we should, not for the purpose of the presentation, but I think so we as a board
Yeah, see where we're at.
understand. Yeah,
Oh, yeah.
yeah. Yep.
Oh, yeah, geez.
Yeah.
Mm.
Yeah.
these last few slides, Taylor may be able to help with,
Yeah.
How much
You
of
know.
this is happening now?
yeah.
And I guess the big question is what about other illnesses that they haven't gone away, and how much time have they really had to
Oh, I know.
to talk about all these other illnesses? And that's why you need, an issue.
Especially, we have the private schools in town, and there's a lot of travel,
Yeah.
to other countries where.
Yeah, we have no idea about some of these other illnesses right now. So
I know.
yeah, she put it on there.
Yeah.
Salmonella, the foodborne
Yeah.
illnesses and travel.
So actually, maybe I'll ask for a list of traceable cases in the last year.
Is the Board of Health, and Nancy, you may know the answer, is the Board of Health also responsible for sexually transmitted illnesses as well? I know that Hep C's on there, but HIV, gonorrhea, chlamydia, or does that go to the state level only?
I've never heard Leslie in all my years of
Okay,
ever mentioning having to track STDs.
okay, so that probably goes to the state then directly.
It must, yeah. But
Okay.
I mean, I know like sometimes she'll have to go and make sure, I forget if it was for TB or
Mhm.
she has to literally go and make sure these people are taking their medication. I mean, it can be
So HIV
really,
is on there, I guess, to some degree. Okay.
yeah.
Can you go back, Chelsea, to the other
Yeah.
slide before? So yeah, this I feel like is going for, like, I know that there was a recent case of an underage selling of tobacco that Heather was all over, that Heather had taken appropriate action on. And I know there's been some ads at some gas stations that someone went and looked at as well, some visible
Yeah,
ads for e-cigarettes. So this is a good example. I think we can use as an example of why you need collaboration and why we need these people long term, because these kinds of threats are always there to our public health.
and not like that the stores are doing anything nefarious, but
Yeah,
I mean, I'm sure they did figure we're so busy with the pandemic who's
exactly,
going to be
exactly.
coming around,
Right.
you know, and doing this. So it's nice that we have someone back doing this because we do
Yeah.
tend to catch, not
Yeah.
catch, not that we're out to
Yeah,
catch.
yeah.
people,
That probably that wasn't the right word,
Yeah.
but you know, just making sure
Yeah.
that our youth aren't being sold.
Exactly.
Right. Good on that one.
Mhm. Oh yeah, we got to, you know, we have the pool inspections and
Yeah.
camps and all of that.
And I know that Taylor was doing a lot of them this year.
Yeah.
Yeah. And does this include, so obviously this will be the camps from Southport Rec, but what about Faye and all that? So that would
Yeah.
still fall under her purview, right? There's just a
They
lot
do.
of private camps as
Yeah,
well.
they have to do the pool at Faye and all of that. Yeah.
Yeah, I didn't even think about it, but there's another animals. Yeah. So do
Yeah,
dog
we issue the beaver trapping licenses, believe it or not.
What about like dog bites? Is there a registry for dog bites and things like that? If they occur, and how we follow those if there is a dog bite in town or something? Do we know how that works? I don't know. I'm just at,
I don't. I
know.
know we used to be part of the whole rabies
right.
vaccine day, but that has, I think, fallen out of our hands. Or well, we'll have to ask on that. I've
I wrote
never,
that down to ask.
yeah, I don't recall ever having an instant of that. Yeah.
I think we probably should reference the blueprint.
Absolutely, yeah.
Blueprint. Doctor. Okay. I'm going to go back to my share note doc.
Okay.
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 And under dog bite, you could also put other animals. I
Yeah.
mean, you know, we got all kinds of things roaming around these days.
Yeah.
So.
All right. So I think we probably need to just summarize.
Yeah.
All the things that we're working on, the things that need improvement, and the overall direction that we're headed in, right?
Okay.
And I mean, I think it would make sense for us to take a position on that so that we're sending a, you know, clear message, and that we unanimously support, or we have different approaches, however we want to do it, but thinking a motion like we're currently continuing to respond to the pandemic.
Yeah.
And at the same time exploring long-term options for sharing resources amongst towns. And I think that can vary in degree, right? Like if we look at the blueprint, there's kind of 4 different phases that you can share resources, and kind of the furthest phase is actually regionalizing, right?
Right.
So, which would be like completely outfitted, right?
Right.
So I think it makes sense. At least I would feel comfortable with continuing to look for ways to share resources with the long-term goal of being regionalizing.
Yeah.
Okay, so I'm going to do
Yeah.
do you want me to say it again?
Yeah. That was well worded. Yeah.
Okay, so I move that this board support the staffing request for FY22 as we respond to the pandemic, and continue discussions and planning around utilizing more shared resources and future regionalization.
I second the motion and vote aye.
And I vote aye.
Okay, Malinowski, aye. So I'm just going to write down that motion quickly so that I don't forget it. I'm pretty sure this is recording, but just in case. So I move. Okay, so Nancy seconded,
Mhm.
and then okay. So does anybody want to write the report? I'm happy to do it, but if somebody else wants to do it, that's totally fine.
If you don't mind doing it, that would be great.
Do you want to create a Google Doc and maybe we can just go in and I'll edit it, or we
We
can't do
can't-
that?
we can't do that.
Okay.
Okay.
No,
Can you email a copy of this and I can work on it? I'd be happy to do a preliminary draft if you want.
okay, you want, sure, great,
Yeah, if you
I
can
will,
just email that to me. I'd be happy to start it. And then I'll
Okay,
send it back
perfect.
to both of you and we can all take a look at it together. And
That
okay,
sounds
that would be
great.
great. And then we're scheduled for
10:30.
October 26th, right?
Right.
Yeah, 10:30 in the morning, correct?
Yes.
Yeah, I have that.
Yeah.
On my calendar.
So I think then we can kind of finalize the report, and if it's one
Okay.
page, then I can just go ahead and print it for town meeting.
Yeah.
And then we'll have had the public forum too. So if there's anything that we want to tweak, then that's fine. Okay, so I will send this off to you. And then I think in the meantime, what I'll do is I'll send that slide deck to Heather and Taylor and see if they can update the colors if we've improved. Just so that we can have an up, I think maybe we keep that as a live document. So that way we can know where our improvements are and where we still have some areas to improve on.
And I'll make this very like bullet pointed, because I think people are more likely to read like a bullet. So we'll see.
I
I'll try
agree.
to get like the 10 main bullets or 7 main bullets of this, so that
Okay,
when it's handed, because just looking at what people read at town meetings and those big long things, like something very concise will hopefully help out.
Yeah. Even
know
if
what
the
else I-
main issues are like a certain bolder color to
exactly,
catch
yeah,
your eye, and then
yeah.
if they want to read the little,
They can,
know.
right?
Safdar, I'm just gonna add in here how we got here. Like, I think something just brief, like the pandemic hit, understaffed,
Yeah,
utilized, funding available through FEMA cares. And now asking to fund positions.
something.
Yeah.
And probably just to, to really best, I'm trying to think of the wording, but here's something to really best, maybe tackle isn't the right word, but best,
serve
collaborate
them,
with, to best approach handling public health threats that currently exist and, be prepared for future. Be prepared
Yeah.
for the future, something to that effect, because I think that people also, I think one of the big selling points is going to be is that, the public is looking post-pandemic already, even though we're not, because we're in the thick of the pandemic. And I think they're really they're going to need to be convinced that there are public health threats now other than the pandemic, and that, preparedness is key. So.
mhm.
Yeah. Okay.
Yeah, we don't want to become complacent and,
Mhm.
No.
let our guard down.
Right.
Right. Okay. All right. Well, I think this was helpful, Safdar. I'll send this off to you.
Yeah.
And because we discussed all this in a meeting, when you send the report, that's fine. And we'll see you all next Thursday for the public forum.
Oh, yeah, I won't be there, but I look forward to watching it. Yeah.
All right. Okay.
All
So is there a motion to adjourn?
Yes, I make a motion to adjourn.
I second.
Okay, Sacco. Sorry, I didn't hear
Oh,
you.
aye, yeah.
Safdar
Yeah, I.
and Malinowski is I at 7:51. Okay, great. Everybody have a great day. Thank you so much.
Thank you.
Thanks for making us.
Okay.
Thank
Thanks.
you.
All right.
Right, bye.